Hello and welcome to Verbling. Good morning, good evening, good afternoon, what have you. I'm teacher Oakley, and for the next hour, we will be learning vocabulary in some way related to hospital, going to the hospital, staying in the hospital, anything and everything that might have something to do with the hospital. In addition to learning some straightforward nouns, we'll also be looking at some sentence constructions, phrases, and chunking verbs with object nouns and common conversational elements that we use when we're talking about the hospital. In the class, the students will take turns doing some exercises, fill in the blank, mix and match, or we'll do a little bit of reading and discussion to start, for example. And so we'll do a little conversation along the way. Okay, plenty of room in the class, so please join us. And we've got a lot of material, so I'm going to jump right in and get started. Hello, Heidi. How are you today?
Hello, nice to see you again.
Likewise. How are you?
Fine, thank you.
Okay, glad to hear that.
Oh, yesterday terror attack happened in Jakarta.
Yeah. Yeah.
World is breaking.
Yeah, but you know that I can't help myself. I have to say something in response to that. The terrorist attack in Jakarta, my God, what a bunch of incompetent. I think they killed 2 people, which is a tragedy. Of course, I don't mean to belittle that at all. But 5 of them get killed. 5 terrorists got killed to kill like 2 other people or something.
But even in
incompetent.
There are several terrorist groups, like Abu Sayyaf or some, right?
Yeah. Anyway. Yeah. Anyway. Okay. Let's go to the hospital and learn vocabulary. Let me welcome Carlos. Hi, Carlos. How are you today? Carlos.
Hey, hi.
There we go. Okay. I couldn't hear you at first. Hi. Welcome. Francisco is also with us. Hi, Francisco.
Hi, teacher. Nice to see you.
Likewise, as always. Okay, actually, before we get started with the material, right off the bat, the word hospital itself. This is interesting in regards to British versus American English and how we treat the word. And it brings up an interesting point. So, British speakers say, like, my grandmother is in hospital. No article. No definite article, the. Americans say, my grandmother is in the hospital. Now, why is that? Let's think about that for a second. The use of the definite article, the. For some places, I'm going to the library, the train station, the mall. In other places, we don't use the. I'm going to church, to work, or British English, going to hospital. The reason for this is because when we talk about going to school, to work, we're thinking of the concept of working, the concept of educating ourselves. Hospital, the concept of healthcare. Slight difference in English and American and British thinking in regards to hospital. Obviously, British conceive of it more as the concept of healthcare, and Americans tend to think more of the specific location. What is the rule? Well, basically that's it, as I described. If you conceive of it as a place, then you should be using the definite article the. If it's more of a concept, that's when we leave out the. So, okay. So much for the hospital. I'm an American. I make no apologies for that. So I'll be referring to it today as the hospital. Okay, let me do a little screen share and we'll get started. Our first little exercise, we're going to do I'm going to have you guys read some of these sentences at least, and we'll talk about it a little bit to make sure we understand the key words, key vocabulary. So Heidi, number one.
Has he had a result of his X-ray?
Okay. Of course, in healthcare we have many tests, so we're always, you know, the doctor makes his diagnosis based on the results. Heidi, I know for a fact that you've had an X-ray.
Yes, before.
Yeah, because you told me you broke your wrist.
Yeah.
Yeah. So I'm absolutely certain they gave you an X-ray if you ever break a bone. Okay.
And, sometimes I got X-ray in the dentist office.
Oh yes, right. I hadn't thought about that. Very common to have your teeth X-rayed at the dentist's. X-ray, of course, shows the bone or hard material inside your body, right? Supposedly, it is dangerous to get too many X-rays because of the radiation. The picture's actually formed using X-ray radiation. Okay, moving on. Carlos, number two.
He gave me an injection.
All right. What's another word for an injection? No?
Oh, no, I don't know.
Okay, well, in simple conversational English, very basic, very casual, it's a shot. I got a shot. I hate getting shots at the doctor's office. The doctor gave me a shot of antibiotic or whatever. More formally is an inoculation. What's the difference between ho-hum, an injection, and an inoculation? Do you know?
No, I don't know.
Okay. An injection, for example, if you have some kind of a severe infection, you may get an injection of penicillin or some other antibiotic. An inoculation, your children get inoculated against measles. They get inoculations for various things, mumps, rubella, what have you, polio. Inoculations are the preventative shots or injections that usually small children get. They get a series of inoculations when they're quite young.
Isn't it vaccination?
Yes, it is. And thank you. They get vaccinated. The noun form is vaccination, to vaccinate. That is correct. Same thing. A vaccination and inoculation are actually the same thing. You can use them the same way. I was vaccinated for polio. I was inoculated. We consider vaccinated more of a general term, and inoculation is usually used more very specifically. But yeah, they're the same thing. You're correct. All right, moving on. Francisco. Whoops. Number three.
Okay, number three, I needed 4 stitches.
All right. Okay. Why would you get stitches?
Why? Because well, maybe I got a cat or...
Yeah, exactly. So what are stitches? They basically sew you up like you sew up like you sew clothing, right?
Yeah.
Yeah. Do you know another more formal word for stitches?
Not
No.
sure.
Sutures. Okay, the doctor might refer
right.
to them as sutures. Oh, okay. Have you ever had stitches?
Yes, once, teacher.
Okay. Did you go back to the doctor to pull out your stitches, or did you just pull them out yourself?
No, I went to the doctor and he
Okay.
put the stitches.
I've had stitches so many times I don't bother going back to the doctor to pull them out. I know how to do it myself. Yeah, I don't even bother spending the money.
Yeah.
I can do it myself. All right, continuing. Heidi, number 4.
I'll just put a bandage on it.
All right. Um, well, when you think of bandage, what do you think of?
Bandage is uh, like which is bandage? For example,
Hmm.
like Scotch tape.
Well, that's just the question. That's why I asked you. Was it trick?
Or a simple cloth along
Yeah, exactly. It was a trick question.
ribbon or something.
Yeah, it was totally a trick question. Yeah, because it's both. A bandage can be when they wrap your arm or whatever, your wound in gauze, that white kind of muslin cloth that they use, right? Sterile cloth, very light cloth. That's gauze. That would be a bandage. You know, you get a huge bandage on a big cut or a big burn or something. Or at home, you wouldn't even go to the doctors for it. That yeah, it has little tape and then a little tiny piece of gauze. Okay. Now here's another one, British American. British people call it a plaster, and Americans call it a Band-Aid. This is Band-Aid is actually a brand name, which we've gradually or whatever over time um, adopted to represent all of them, no matter who manufactures it. We call them all Band-Aids in America. Interestingly, Band-Aid, Heidi, it has an idiomatic meaning. What do you think it means if I say the phrase a Band-Aid solution?
I don't know.
Okay, the politicians are just applying a Band-Aid solution to the economy.
Oh.
Or, ooh, the Chinese stock market, the Chinese government is just using Band-Aids to fix the problem. Like that. Okay, yeah. Yeah, well, the idea is very temporary and probably not long-range useful. Right? This is a common idiom. Just a fast kind of reaction solution that won't take care of the problem long term. All right. So yeah, bandage is quite general. So that it can mean any of those things. Carlos, number 5.
It won't leave much of a scar.
Okay. Keyword here is the noun scar. Do you have a lot of scars?
No.
No? How about emotional scars? Ha ha! Ah. You know what I mean when I say this is a common collocation, an emotional scar?
It's about feelings.
Yeah, it's about feelings. Something like, if your father dies when you're quite young, it may leave a lasting emotional scar. So, although we normally think of the very physical kind of white mark that is left after a wound or a burn heals, we shouldn't forget that we also quite often use it to talk about emotional scars. Scarred for life. Okay, if somebody's scarred for life, here's an expression. Again, it's not physical. We're talking about an emotional scar that's changed that person's personality forever. Keep in mind that Americans, at least, like to use this phrase, scarred for life, as in a very sarcastic way, really joking sometimes. Um, okay, your boss yells at you for something. You might sarcastically say, "You've scarred me for life. I'll never write another email without a heading. I've been scarred for life." Okay, jokingly. Oh, all right. Francisco, number 6.
Okay, you'll need an anesthetic.
All right. Have you ever been given an anesthetic?
Yes. When the doctor put me the stitches
Oh, right.
before.
Okay. Right, of course. Sometimes it hurts getting the anesthetic more than it hurts getting the wound.
Yeah, because
Yeah.
sometimes they are provided by a needle.
That's right. And they jab the needle into your wound, which is terribly painful.
Yeah.
Yeah. It's actually the part, if I injure myself, it's the part I hate most. Getting a local anesthetic, okay? Like you cut your hand and you needed stitches, so they need to numb, uh, cause you to lose feeling in just one small area. That would be a local anesthetic, as opposed to if they're trying to knock you out to do surgery or an operation, then they would give you a general anesthetic.
Yeah.
Yep. Which might knock you out, so you sleep through the operation. Yeah. Okay. Yeah. And all right. There's a special doctor who applies the anesthetic, an anesthesiologist. He's specially trained in med school. This is considered a very specific type of doctor. And at least in America, you can't perform an operation and you have to have a specific anesthesiologist. Don't worry, it will appear on your bill as a separate charge.
Yeah.
Yeah. Okay, Heidi, number 7.
They were all suffering from shock.
All right, and this is a little bit tricky, but what is shock? Can you describe what that means?
Broken heart.
Wait. Not exactly. Okay. All right. Shock has a lot of meanings. All right. You can be shocked and surprised because somebody throws you a surprise birthday party. Oh my God, I can't believe it. All right. You can be shocked and surprised because you grab a bare wire and you get an electrical shock, which would both electrically shock you and surprise you, I'm sure. But when we talk about it in regard to like accidents and hospitalization, it's something else. They're actually talking about a physical thing, and I don't really know how to describe it. It's people are in shock. They don't know what's going on. They can't talk. Generally, somebody goes into shock after a very traumatic accident. Their body starts to shut down. It can have many symptoms, I suppose, but I don't know. The first aid, yeah. Go ahead.
Broken heart is the biggest shock.
Is it? Okay. All right. If you say so. How poetic of you. But okay. Yeah. Yeah, it's actually a medical physical condition, and it's not good. This I do know. It's not considered a good thing. And you have to treat someone for shock to make them comfortable. Otherwise, they kind of slip into this very, very bad, bad place where they're hard to treat, they're hard to deal with, and may become unconscious or something like that. Sam has joined us. Let me quickly say hello to Sam. Hi, Sam. How are you?
Hello, good morning.
Hello. Morning.
Hello, everyone. Hi.
Hi. Talk to you in a little bit when we come around to you, okay?
Okay.
Carlos, number 8.
We were in the same ward.
All right. Well, what does that mean? What is a ward?
The same room?
Not exactly. Close, but not exactly. Do you know the names of any wards?
No.
No. For example, the maternity ward is the section of the hospital where women give birth. Okay, so not just one room, but a whole series of rooms. It may include an operating room, a recovery room. It may include a little room for pre-op, pre-birthing. Maybe it has a little jacuzzi in it. Okay, so it's a section of the hospital, you see. Intensive care ward, if you're in a very serious condition and you need a lot of care, you might be in the intensive care ward. Okay, so it's not just one room, but an area of the hospital.
Okay.
Okay. Francisco, number 9.
The treatment will last for a month.
Okay, let's talk about the treatment. Okay, what might be a treatment? What might a treatment include?
Maybe a prescription.
Yeah, most likely a prescription. Maybe a series of actions. It might have to do with physical rehabilitation. It might have to do with some kind of medical equipment that you have to use periodically, whatever, once a week. A treatment is something that basically has to be done to you, not that you do yourself. So treatment is medical procedures done to you or with you. You know, really physical rehabilitation, you're doing it yourself, but there's somebody helping you. Or, you know, if you need to use a dialysis machine, or you have treatment for cancer, that may include a series of shots, a series of injections. Okay, like if you get bitten by a dog that has rabies, the treatment would include a series of injections, or it used to. I don't know anymore, but I forgot. You used to have to get like 13 or 17 different injections. That would be the treatment, which might last a month, for example. Okay, and departments. All right, different departments, including the areas of the hospitals which we discussed as wards. Which department or ward would you go to in these situations? A little mix and match exercise. Sam, where would you go for A? Go ahead and read A. And
She's just had her first baby. Of course, maternity ward.
of course, naturally, obviously. Yeah. Interestingly, in the United States, and I think many places in the world, I don't know, everyone used to go to the hospital to have a baby. Nowadays, it's more and more common to go to a birthing clinic, which is kind of like a maternity ward that's separate from the hospital, has its own doctor, nurses, etc. Sam, is that the case in your country, or does everyone go to the hospital?
Yes. Normally, people prefer to go a private, not a private, but hospital, of course. But some of them, they are not very confident with hospital. They go to the private clinics. For example, lady doctors especially have their own clinic.
Oh, yeah.
And yes, and they would go over there. But if you go back to 40 years ago, or maybe 45, we here in my country we didn't have how we say that educated and well skilled ladies, same as like the nurse or doctors. At that time, that kind of women, they just learned their elder women. So they birth at home. They don't go to the hospital or somewhere else. So the lady, they come to home, yes, and for for how we say that, treat or help them at that time.
Okay.
Mhm.
Uh, okay. I'm having one of those brain block moments. The women that assist in a birth, there's a specific name for them.
Yeah. How we say that?
My goodness, I'm having a total brain block.
Hmm.
Help. Anybody in class? What does anybody remember that vocabulary word? It's like on the tip of my tongue and I can't squeeze it out of my brain. Anybody in class? Can anybody remember women that specifically assist during birth? And this word goes back to, hundreds of years ago. Oh my goodness. All right. Well, hopefully I'll remember it in the course of the class.
Okay,
Just
sure.
can't. All right. All right. Heidi B.
She cut her arm badly. Outpatient department.
Yeah. Okay. Yeah. Probably. You would just go to the outpatients department. Okay. Huh.
Because it's not chronic disease at the first time, so.
They're not going to leave you in the hospital overnight. That's the idea of the outpatients department. Yeah. Okay. I'm slightly confused and hesitant because the names are slightly different in American hospitals. In American hospitals, usually you have an emergency room, and the emergency room includes both, of course, the really severe, life-threatening patients, and you go to the emergency room for you cut your arm badly or something like that, and they may make you sit there and wait. You cut yourself, but you're not going to die. That you may be sitting there for an hour before you get to talk to someone. But all those people go to the emergency room, and then they decide where to take you from the emergency room to like just an outpatient place, or yeah. Anyway, thank you, Francisco. All right, there it is, midwife. That's right, a woman who helps women have babies is a midwife. Right. Thank you. Okay, moving on. Carlos C.
He's having his operation. Operating theater. How do you pronounce it?
Theater.
Theater.
Well, this is kind of weird for me. Again, with the British and the American thing. Number one, theater is one of those words that in British English is spelled R-E at the end of the word. American English, the spelling is E-R. Second point that I find confusing as an American, an operating theater would be an operating room which maybe it's being used in a medical university, medical college, medical school, so that students can actually sit in like a little miniature auditorium kind of thing, and they can look down into the operating room and actually watch the doctor perform. It's actually a theater. That's what it means for me as an American. As an American, just a regular room, a regular doctor would perform a regular operation, is an operating room, straight up. So it's a little different, but British use operating theater for any kind of place an operation occurs. Okay, so it's a little different. Carlos, you ever been in the operating room?
No, no, never.
Yeah, keep it that way.
Yes.
Indeed. Okay, Francisco D.
Okay, our 10-year-old has a very high temperature. Maybe he's in intensive care
Maybe.
or children's
Uh,
ward.
okay, maybe. Um, maybe children's ward. Now this is weird because again, you'd bring your child in. It's a little different again with the American and British. Children's ward for Americans would be if the child actually has to stay overnight in the hospital, they'd go to the children's ward. Okay, which might be the case. They keep a 10-year children with the very high temperatures. They want to keep them for observation. Which is also very useful because you often hear this phrase in hospitals. We want to keep young Charles for observation, so they're going to keep them overnight in the children's ward. Yeah, right. That would be common. Okay. All right. Sam, E.
Okay. I had to go for a checkup. Um, checkup for
Yeah. Do you know what a checkup is?
yes. Can we say that in output patients department?
Outpatients department. Yeah, I get.
Outpatients department. Yeah.
Yeah, I think so because a checkup is absolutely
It's a
not
look.
any.
Yes.
It's not an emergency.
Yeah, it's a normal.
It's preventative care, not reactive
Yes.
emergency care.
Yeah. Exactly.
Okay, so all right, definitely an outpatients department for a checkup. Earlier she cut her arm badly. Okay, I think the better answer here would have been casualty
Yeah. Exactly.
department. Again, in American hospitals, it would be emergency room. Oh, you have to take her to the emergency room, where she may be referred to the outpatients department. Okay, so they're kind of the emergency room. I don't know how it works. I've never been injured in England, to be honest, but in America, you go to the emergency room and they could hustle you up to the operating room if you needed surgery right away, or they could move you into intensive care, or they could tell you to go to the outpatients department if it was something that was clearly not an emergency that could wait. Yeah, Sam, hustle. Hustle. Oh, here's a weird word. Okay, to hustle. To hustle means to move very quickly. It can also. Okay, all right. You need to hustle. Yeah, no, it's a verb. All right. Go fast. It's all right. Strangely, yeah, it means go quickly. It's often used to talk about sports, actually. We need more hustle out there, okay? Not only moving quickly, but desire, and it also has to do with desire and what we euphemistically call heart. All right, basketball team, the coach might say, we need more hustle out there. Dive for the ball that's going out of bounds. Crash the boards. Okay, so the word hustle means go quickly, but there's a little more to it. Hustle with heart, with purpose. Move fast with purpose, I guess. Okay, well, Francisco brings up the American movie American Hustle. Hustle also means something else. If you hustle someone, you trick them or con them. That's what that movie has to do with. Are a bunch of guys conning each other, tricking each other out of money. So don't fall for it. It's a hustle. Okay, it's a setup like that. So actually, there's another meaning. So thank you for pointing that out. Okay, last one here. Heidi.
She's very ill. She needs constant attention.
Yeah.
Intensive care.
Yeah, all right. Where you're constantly monitored. You're probably on monitoring machines. You know, maybe the little machine that goes beep, beep, beep. I knew it was serious when they hooked me up to the machine that went beep. Okay. All right, so here we go. Another name for casualty department is accident and emergency. In America, it's the emergency room. There's a big sign over the door that says emergency, so nobody could mistake where to go if they have a serious injury. Okay, we'll come back to that. All right, basic picture mix and match. Carlos, ambulance.
2.
2, obviously. Okay, what sound does your ambulance make in your country?
The siren.
Siren, yeah. Yeah, but what kind of, all right, exactly. More to the point, what sound does a siren make? Is it or is it
The first one. The first one.
I was just trying to get you to make an annoying sound. Sorry. Yes. Okay. I love the ones that go because then with the Doppler effect of sound as it goes by, it changes the pitch. Sounds really cool. All right. That's just silly. Francisco. Nurse.
Nurse number 3.
Yeah. All right, but this is kind of sexist in my opinion. There's more and more male nurses now. It's very common. Yeah. Anyway, yes. What does a nurse do?
They take care of the patient.
Yeah. Basically. Yeah. A doctor makes the diagnosis and decides what the treatment will be, and the nurse actually does it. Takes care of it, and applying the treatment, and takes care of the patient. That's it. All right. Sam, surgeon.
Yes, surgeon number 1.
All right. Probably. Most likely that's a surgeon. Surgeon, of course, is one specific kind of doctor, and there are many kinds of surgeons as well, specialty surgeons. Sam, do you know any kind of specialties a surgeon may have?
Yes, bone surgeon. And
okay.
Yeah, and
Really?
yes, physician, journal physician. Oh, we can say
Well,
that.
okay. Well, yeah, a general physician.
Yeah,
True,
and
but that's not a surgeon. That's a doctor.
okay, doctor, surgeon. Um, how we can heart?
Heart surgeon. Yeah,
Yes, heart surgeon.
common English. Heart surgeon, brain surgeon.
Mm-hmm.
Yeah.
What about eyes? Can we say that eye surgeon?
Eye surgeon, yeah. So see, some of the okay, heart surgeon, brain surgeon are very common in everyday English, and then of course we have the specific, all right, a woman doctor is an obstetrician, an eye doctor is an I don't know what. Okay, children's doctor, pediatrician. You know, we have the names, the specific names, and frankly. Yeah, frankly, I don't remember eye doctor. If anybody remembers it, that's great. But doctors for, very specific parts of the body, they have different names. And I think I'm a typical American in that I don't remember. I remember two. What I just said. I don't. There's probably 30 or 40 different other specific classes of doctors, some of whom perform surgery, some of whom do not.
Mhm.
But yeah. Anyway.
Okay.
Okay. Heidi, paramedic.
Paramedic. Oh, 6.
Yep. There he is. Okay. Have you ever been saved by a paramedic?
No, but I witnessed car crash.
Yeah.
Then I called.
You did. Good for you. Okay. All you people who call emergency medical services, thank you all very much. I myself was in a car. Crash! The car was really smashed up like a tin can. Basically, briefly, my car was stopped in traffic. I was not moving at all. And an old man, he was 86 years old, he was looking at a plane in the sky. From behind me, he struck my car going roughly 100 kilometers an hour. So my car hit the car in front of me, and I got trapped in my car. So the paramedics, or EMTs, emergency medical technicians, the EMTs came, and they had to use a. Do you know what they used to get me out? They had to cut me out of the car. Heidi, do you know the equipment they use when they?
Yeah, some give him the patient electric shock.
No, nobody gave me a shock. Thank heavens. No,
No.
thank goodness, no. They use it's like a chainsaw, but
Chainsaw.
yeah, they use like a chainsaw, but it cuts through metal. And there's this other device that's electronic, hydraulic, whatever. It's like scissors, but enormous. It can cut through giant chunks of metal. Anyway, the jaws of life, it's called. They had to cut me out of the car, which was pretty cool. And I was relatively uninjured, but I was totally trapped in the car. I could not. There's no way I could have gotten out of the car by myself. So thank goodness for the EMTs. One of them I happen to know fairly well, and he hung out with me and talked to me, kept me calm, joked around. He was actually making jokes the whole time because he knew me. He knew that I have a weird sense of humor, and I might find some humor in the whole thing. Anyway, moving on. Carlos, patient.
Okay. Patient. 4.
4, of course. All right. What's the other meaning of the word patient? As an adjective. I am very patient, or I am not very patient.
Patience? I don't know.
Yeah. Patience. Yeah. Okay. The noun form is patience with an C. Okay. Yeah. There's another adjective meaning patient, meaning that you're able to wait. You don't get frustrated if you have to wait for things, or yeah, or you can withstand a lot of annoying things without getting angry. You have a lot of patience with small children, for example. Yeah. But yeah, as a noun, patient is a human being who's being treated. All right. Francisco.
Stretcher.
Yeah, stretcher.
Number 5.
There it is. Have you ever been on a stretcher?
No, never. Sure.
Yeah. Try to avoid it. Okay? That's my advice. My advice, try to avoid it at all costs. Okay. Little mix and match here. All right. Once we're out of the hospital, or as we walk out of the hospital, whatever. Okay, a little mix and match. Sam, number 1.
His legs in plaster.
Hmm.
Okay. His legs is plaster. Yes, G.
Yes. Okay, and Americans would not. This is what it's confusing in England, in British English, because plaster refers to this thing. You're right, and it also refers to a type of bandage, so it's a little confusing. In the United States, it's a band-aid, and this thing, G, is a cast. We would call that a cast. His leg's in a cast. He has a cast. Okay, and the tradition in America, when you get a cast, all of your friends sign your cast, get well soon, signed Oakley, don't get in any more accidents. You write little silly notes and you sign your name. Kind of a tradition. Sam, do they have that tradition in Pakistan? If someone gets a cast, do people sign it? No?
A cast.
Yeah.
In as an actor?
No.
No.
Just anybody,
Mm-hmm.
especially when young kids and teenagers get a cast.
Mm-hmm.
Okay, when people, especially again, children and teenagers, when they get a cast in the United States, okay, all of their friends will sign the cast with a pen, with ink, with a
Oh,
marker,
okay. I understand.
and draw
Yes,
pictures.
yes.
Yeah, okay.
Yeah. Yes, because this is a very uh, board, like a board, and you can write very easily, and yes.
Yeah, all right. It's kind of a tradition in the United States. You get all your friends to sign it, and whatever, people draw pictures on it, whatever. Okay. Anyway, moving on. Heidi, number 2.
His arms in a sling. E.
Yeah. Yep, definitely E. You ever have your arm in a sling?
Yes, sure. I mentioned before.
Yeah.
I broke my arm.
Thought so. Yeah. Okay. All right. Obviously, if you break your arm, but possibly other things like a sprain or some other severe arm injury, you might have a sling. Okay, Carlos, number 3.
He's walking on crutches. D.
Yep, there they are. Crutches, the 2 supports that you use to walk because you can't use one of your feet. You ever have crutches?
Yes, one.
Yeah. Oh yeah, we talked about that the other day. No fun.
Yes.
No fun at all. Francisco, number 4.
He needs a walking stick. C.
Yeah. What's the other name for a walking stick? Very common. You know?
Bastion or something like that?
No. A cane.
Right.
That's it. A cane. He uses a cane. Again, I don't know. I don't know about British. A lot of differences when it comes to medical things, British and American. An American would say, okay, if I go hiking, I'm perfectly healthy. If I go for a hike and hike a high mountain, I can use my legs very, very well, thank you. But I might use a walking stick to help me hike. That would be a walking stick. A cane would be, all right, an old man needs a cane, or else he can't walk because he has physical problems. There's a distinction for Americans. For Brits, I guess they're the same thing, really. They also use both terms, but obviously they're expressing the idea here that a walking stick is to help physically, but it's not really what it means for an American. All right, Sam, number 5.
His ankles bandaged up.
Ooh,
Okay.
where? Huh?
Bandage.
I don't
Okay.
I don't see that. Oh, there it is. He's
Hat.
hiding. He was hiding. Sorry.
Ach.
Hiding around the corner there. Yeah, all right. He's got the gauze bandages on his leg. Sorry. Yeah. Okay. Okay. Moving on. Heidi, number 6.
He had to have stitches. F.
Yeah, hard to see, but on his arm here, he's got stitches. He's been stitched up. Yeah. All right. Carlos, number 7.
He's in a wheelchair. A.
Yep. A. All right. You ever use a wheelchair?
To play only. No.
Play. Yes. Try to pop a wheelie. Did you
What?
try to pop a wheelie?
What is that? I don't know
Okay.
what it is.
A wheelie on like a motorcycle is when you go on one tire, your back tire. Ooh, a wheelie. So if you
Okay.
the action, we often use the phrase pop a wheelie on a motorcycle, but you can pop a wheelie on a wheelchair. You pull back the on the tires on the wheels so that your front wheels go up in the air, Woo! Pop a wheelie. Yes, of course. I remember when I was young, one of my friends had a pretty bad injury in skiing, but anyway, he had a wheelchair, so of course we all had to try out his wheelchair and play around with it, and yeah. Okay. Francisco, number 8.
Okay, he can't walk without a Zimmer. B.
Yeah, this weird thing is a Zimmer, the little 4-posted walking device. That's it. Okay. Moving on. Let's look at some collocations of verbs and such, which we're going to be using to talk about treatment. Some basic verbs: put, need, do. Okay. Here we go. Go ahead and go ahead and read the sentence and fill in the blank. Sam?
Okay. I'm going into hospital next month. I have got to blank an operation on my knee. I have got to need an operation.
No, I have got
I have
to
got-
is
I have
already
got to. Okay.
yeah, that's already a phrasal modal, so you wouldn't have 2 modals in a row. That
Okay.
weird.
I have got to do.
No, if you've got to do an operation, that means you're the surgeon. The surgeon does
Do.
an operation.
Okay. Okay. I have got to do.
So no, this
No.
doctor do means you're actually doing it. So the doctor does the operation.
Okay.
Right.
I
But
have
you're the-
got to. I have got to
So it's
put.
a passive
Have.
idea.
Okay.
You're not
I have got have to.
okay.
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 I've got to have to
All right.
an operation on my knee.
So
Oh
it's-
my gosh.
Kind of a passive structure. I have to have my
Mhm.
haircut. I'm going to get my haircut, have my haircut. I'm going to have okay. We usually use have an
Mhm.
operation.
Have an operation. So we can say that here is a how we say that? Possessive?
Possessive, passive.
Possessive. Passive. Yes, passive as well. But have and has we also use as a possessive. No?
Well, okay.
I
Well,
have to
no,
have.
not really. In this case, it's kind of an odd passive structure where somebody else is doing something for you. I'm going to have my hair cut. I need to get my car fixed. I need to have my car fixed. I need to get my car fixed. All right, meaning somebody's doing something for you, not like the regular passive structure where just something, the action is being done to you,
Okay.
to something.
Okay.
All right. So this is the structure we use to talk about. I need to have my lungs looked at. I've been coughing. I need to have my eyes checked. I can't see well. This is very common to express the idea that you need to have someone look at a medical condition. All right, Heidi, number 2.
I couldn't feel a thing. They gave me an injection first.
Very good. All right. Obviously, what kind of injection?
I'm not sure. Anesthetic.
Yes, anesthetic. That's right. Because he couldn't feel a thing. So clearly it was some kind of anesthetic. All right. Carlos had to go. So Francisco, number 3.
Okay, it's quite a long operation, so we'll have to give you a general anesthetic.
Mm-hmm. Okay. Oh, okay. Give again. Yes. Oh, yeah, some of them are more than once. Very good. Yes, definitely. They give you a general anesthetic. We talked about that before. So they're going to put you under. Ah. Okay. Do you know what that means, Francisco? If the doctors want to put you under.
Put you under?
Yeah. Yeah. Ah. They want you to sleep through the operation. So they're going to knock you unconscious.
Okay.
But planned with an anesthetic. Not, in a boxer knocks somebody unconscious, they hit them, okay? You wouldn't say the boxer put him under. No. When the doctor does it with anesthesia, they put you under.
Okay.
All right.
Right.
Right. So that's the difference. Okay. Okay. Sam, number 4.
Okay. They will probably want to blank some X-ray to see if you are broken, if you have broken anything. Want to want to do?
Yeah, want to do some X-rays, do some tests.
Mm-hmm.
Also they're going to take an X-ray. The doctors want to take a blood test. Commonly, the do or take
Okay.
are used for basically any kinds of tests. All right. Heidi, number 5.
5. Your ankle's badly sprained, so I'm going to put a bandage on it.
Yep. Okay. Put on a bandage. Very good. Uh-oh. Francisco, number 6.
It's quite a deep wound. I think it's going to need stitches.
Yep. Going to need stitches, going to require stitches. Yeah, that's pretty straightforward. Sam, number 7.
Okay. I'm a bit worried about having stitches. Do you think it will blank a scar? It will leave
Mm-hmm.
a blank scar.
Yeah. Will it leave a scar? This is a common question people ask the doctors. Will it leave a scar? Okay. And last of all here, Heidi?
I injured my knee skiing a few months ago. I was hoping that resting it would be enough. but it looks as if it might need.
Need again. Yeah, it might need surgery. All right. And my time is up. So thank you. Thank you very much. You guys have a great day. Maybe I'll see you later in the day, but so long for now. Thank you.